Greetings to you all with love and respect on this day of the coronavirus. Today, my focus will be on breast asymmetries, especially in women, and I will elaborate on this subject. Friends, as a matter of creation, when we cut ourselves in two, meaning by drawing a straight line to separate left from right, we realize that none of us are symmetrically created. Everyone has some asymmetry. We are all born with some level of inherent asymmetry. One reason for asymmetry is its inherent nature, while another reason is the asymmetries that arise after surgical procedures. I will talk about how to correct asymmetries that occur following surgical procedures today. What breast procedures do we perform on our female patients? We perform breast surgeries including augmentation, reduction, and lifting, and we can also increase breast size during lifting operations. We can summarize the breast surgeries we conduct for women into 4 primary categories. I say this while excluding reconstructions and repairs following cancer treatment. Now we will talk about breast augmentation and reduction. During the examination, we assess if there is any existing asymmetry prior to the surgery and make our plans based on that. We aim to reduce those asymmetries as well. We try to conduct a surgery that equalizes as much as possible if we can achieve it. However, no matter how careful we are, I or any of my physician colleagues may encounter cases where we cannot fully correct this asymmetry. In my patients, or those treated by other doctors, we may see asymmetries due to physician-related issues or complications that arise post-surgery. We encounter asymmetries from healing problems that arise after surgery. What should we do in these cases, friends? Here's an example for you. We performed a breast augmentation surgery, and after 5 years, pregnancies and breastfeeding have all caused some deformities. Past mastitis cases, our female patients know this, have caused asymmetries due to infections in the breast. It's been 10-15 years since our surgery, and the patient has come back to us. We see that there is an asymmetry. In fact, when we compare it with previous photos, it has become more pronounced. We will look at that breast again in a few years. When we plan the surgery, we will resolve these asymmetries, such as by changing the size of the implant if it exists. We can solve these asymmetries by using different sizes of implants. Thus, if an asymmetry problem arises with the breast during reduction or enlargement, and it is very noticeable, minor adjustments may be needed. It's important to disregard small asymmetries, my dear friends. Even if the goal is 100% symmetry, I always say we should be satisfied with 99% or 98%. However, if there is a major asymmetry, then corrections can be made easily with a good plan. If you have such a problem, we will gladly strive to help you resolve it. Looking forward to seeing you.